up, please.
Good morning, everyone. My name is Xavier ABADIE, and I'm a Chief International Development Officer at SimforHealth. Virtual solutions for medical education. SimforHealth wants to be the world leader in digital education for healthcare professionals. We are based in Bordeaux, France, but have offices in Paris, Montreal, and Boston. Never the first time with the patients. As jet pilots would train hours and hours on flight simulators prior to entering their planes, we do believe that healthcare professionals should also digitally train, prior to get with the patients, and then obey this principle, never the first time with the patients. We are convinced at SimforHealth that this digital simulation can help with patient management and patient care. Therefore, we have developed a SaaS-based model platform called MedicActive that is innovative and collaborative, and that enables all providers, whether they are doctors, nurses, any healthcare professional, to access, create, and share medical education contents. We use for that the latest in IT technologies such as 3D, real-time 3D, but also augmented and virtual reality to digitalize and recreate the healthcare environments so that people are really immersed into what they're doing and make it as close to reality as possible. Like iTunes, MedicActive would offer the healthcare professionals the opportunity to access training modules, but also to create their own modules and then being able to monetize them on the marketplace that goes with the platform. As an example for that, we've developed a virtual reality case with the Stanford Medical in California, and this module has been used by Chinese university to train their cardiovascular interns, residents, on some cardiovascular procedures. The platform is also, of course, adapted for the industry, whether it's pharmaceutical or medical device, and there's a lot of people here this morning that come from these industries. Whether you get your own private space in the platform and being able to create seamless, innovative, and global training programs for your customers, your KOLs, of course, but also internally for your MSLs or reps. We have trained already more than 30,000 healthcare professionals worldwide, so we're very happy with that. And of course, would be on table 26 if you want more on digital simulation for healthcare professional training. Thank you very much. No questions?
So the question is, how much content do you have?
Yeah. We have already content that is quite full with many industrials that can be accessed by those industrials, and we've worked with the top 5 pharma companies, for example, worldwide. We also have contents that have been developed that can be shared by French universities or Canadian. We're working at the moment with the University of Montreal, for example. So I would say we'd have around 100 shared cases that can be shared, and a lot more that cannot, because it's for the use of the professionals, the companies that we've developed it for. Yep.
Across what or which medical disciplines are you concentrating now already?
Well, that is a good question, because as you have understood, the concept can really adapt to any specialty or whether for initial or continuing training. We have a lot of on cardiovascular. We have worked also on some chronic diseases, and mostly on cardiac. We have worked on diabetes. We have worked on there's a lot mental illness. We do have also programs that are not directly linked with a specialty by itself, but for team training or team building or patients communication. So, for example, we've built programs with the French City of Radiology to explain patients, to teach doctors, radiologists, to explain patients some difficult exams that patient will undergo. So this is very useful also. Thank you very much. Thank you all.